Hi, I'm Judy Lee, and I am running for re-election to the District 13 North Dakota Senate seat. I was originally encouraged to run, and I said no many times because my husband and I had 2 kids in college, tuition and all that stuff, and we're both very involved with work that required more than 40 hours a week. But more and more people kept asking. And when Governor Schaefer and Nancy got off a plane in the Fargo airport when they were coming in and the chamber board was meeting them, and I was a part of that group, and he walked over and said, "Judy, you've got to run for the Senate." I said, "And who got to you?" So we thought it through and thought, okay, we won't starve to death if I move this forward. We will be fine. And it's been a wonderful experience ever since. My degree from UND was in clinical laboratory science, and I worked in hospital and clinic labs for 10 years, and working as a part of a team to diagnose and treat members of the community, I found to be a really rewarding experience. When we moved to West Fargo, our kids were little, and I was looking for a little more flexibility, and equally important, I knew I would like to work for myself. So I became a realtor, eventually a broker with Park Company, and helping buyers and sellers solve their problems was part of it. In med tech, there's only one right answer to whatever that test might be that we're performing. In real estate, there is never just one right answer. So it broadened my perspective on what we might be able to do, and I thought I may have some talents here in helping people reach consensus about which direction to go. Everybody is concerned about making sure we have a manageable budget. We know that we have challenges right now. Ag and oil are the biggest sources of income for our state, and they are challenged right now. So we need to make sure that we're doing the right thing with our budgets. But at the same time, we need to be very concerned about good schools, the whole education system from K through college. We also need to make sure that our health and human services programs are serving the people who have those needs. And all of those costs are exacerbated by our workforce shortage. So we need to make sure that we are encouraging individuals that are in school or living in North Dakota now, are going to remain here and work here, recruiting students from other states to come in and attend our colleges and stay, and recruiting from out of state in practical ways. Because when people get here, they may have thought that they were being banished to some cold place, and they find out this is a pretty great place to live. And I've had people who were crabby about coming when I was showing homes to them, and she cried when they signed the listing agreement when he was transferred again. So we have a lot of people who are happy to be here, and we want others to join us. Part of our challenge is going to be, again, balancing our economy. We know that there are going to be efforts with all kinds of energy-related things. Data centers is something that there's some controversy about now. I think more education and information about this is helpful to all of us in understanding how the various people who are involved with the data centers explain the issues, and we need to recognize we can't be obstructive, but we need to be educated about something about which we don't know enough to make a solid decision. We need to listen and pay attention and come to some consensus on those kinds of things. We need to make sure that we have good health care and human services. I mentioned that before, but that's a continuing issue, an aging population. The options that allow people to remain in their homes as long as possible with home and community-based services. And just delighting in the fact that we're here among good people who all have an interest in being good neighbors and providing a good environment for their families and a good place to work. I think it's real important that people know that the folks who are working in Bismarck and around the state with the legislature are good people. Whether you want to come in and testify, whether somebody else does, we are a receptive group if there is, and you have the opportunity. This is so cool, actually. We are probably the most accessible legislature in the country. You can watch every single hearing live or afterwards. If you want to know what I said on March 7th at 2 in the afternoon, you could go on the legislative website and I'm there. The other thing is that The lobbyists are sometimes disparaged and shouldn't be, because each of the people that we learn to trust are able to bring us the facts that represent their group. If we have a healthcare bill in there, I expect to hear from the people who represent nurses and physicians and chiropractors and public health and school nurses and senior care facilities and public schools, everybody who makes use of nurses' services in healthcare delivery. I want to hear if there's something good about that bill, or is there an unintended consequence that would adversely affect the people who are currently working in those roles? Because our goal is to listen in these committee hearings, ask questions and listen, and bring the good points of everybody's perspective together as much as we possibly can, so that we'll have something that's good for the state of North Dakota and that can pass 2 houses and be appreciated by the governor so he'll sign it. That's it. That's the process. But it's a good one, and please come and observe it. We love having people come to visit the legislature. Whether it's adults or kids, they are generally surprised and pleased to see how we work and that it's really pretty interesting. And call us or contact us on email. If you have a question about something, all of us want to hear from you, so please do. I have served for several terms, have been chair of the Human Services Committee, and look forward to continuing our work dealing with health and human services in North Dakota.